So you need to identify the incorrect statement about eczema. So these are the options. So if in case you have marked the answer as option D, then probably you have marked the correct answer. Okay. Why? Because the question is asking you to identify the incorrect statement, and among the given options, option D is the incorrect statement. Why? Because we will see that in the flow of the discussion, but before that, just remember that dermatitis is an umbrella term. Dermatitis is an umbrella term which is used to define wherever there is inflammation of the skin. So skin inflammation, whenever it is there, we use this word dermatitis as an umbrella term. So option A says all eczema is dermatitis. Yes, this statement is right. Whereas all dermatitis is not eczema. This statement is also right. Why? Because eczema is one of the types of dermatitis in which inflammation of the skin can be seen, but there are even more number of the skin conditions which can be encompassed and which can be kept under this broad umbrella term dermatitis. And option C, pruritus is hallmark clinical feature, is very correct, and this is the most important symptom because of which the patient will come to us. And not only that, it is because of this pruritus because of which the patient, if he is having the chronic form of eczema, they are going to develop one very important clinical finding which is called as lichenification. This I will show you how does this look like in the image. And option D is wrong. And why is this? I will show you. Okay, acute eczematic eruption is typically edematous, vesicular, and maybe exudative. This is also a right statement. So if we look at the eczemas, we can see that depending upon the duration, we have acute eczema, subacute eczema, and chronic eczema. The differences are going to be in the morphology. So in acute eczema, inflammation can be seen, which is very extensive in the form of erythema. The warmth also can be felt. Edema also will be there due to the intercellular fluid accumulation. This is very important. Why? Because in histopath, this same intercellular edema will look like spongiosis. I will show you in the next picture. Okay, so vesicles can be seen clinically due to this intercellular edema, which will be associated with oozing and also ultimately development of the crust. These are the crusts, which are nothing but dried up exudates. Dried up exudates can be seen. Whereas in the subacute form of eczema, we can see erythema and scaling of these lesions. 1 second, I am coming in between. Right, so here if you observe carefully, there is erythema is there, and you are also able to see some scaling, because in this the oozing and vesicles and crusting are all resolved, as it is a subacute form of eczema. And whereas in the chronic form, we can see what is called as lichenification, and this is very important. This was in fact a MCQ, image based MCQ in this INICET exam as well in 2021, July 2021. So in the stratum spinosum, you must remember few of the dermatopathological terms apart from acantholysis. Apart from this important term, there are other terms which you must know. So one among them is spongiosis, in which in the patients of acute eczema, intercellular fluid accumulation will be seen in between the keratinocytes. This is termed as spongiosis. Very good if you have known this well before. And there is a question for all of you. In herpes simplex virus infections, intracellular edema, intracellular fluid accumulation will be there in the same in these keratinocytes of the epidermis. So can you tell me in this intracellular fluid accumulation of the herpes simplex viral infections, there is going to be development of ballooning degeneration, because of which ultimately there is going to be loss of intercellular connections between the keratinocytes, which is called as acantholysis. But there are two types of acantholysis which can be seen. And my question to all of you is, in herpes simplex virus infection, what is that acantholysis which will be seen? Is it primary, or is it secondary? So you need to type your answer in the comment section. I will check your answer after you have answered it. So as I've already told you, this chronic itching, what it will do in these eczematous patients, chronic eczema patients, is there are going to be three important skin changes which will happen. One is thickening of the skin will happen, there will be increased pigmentation, and there is going to be increased skin markings, all of which are very very profoundly evident in this lesion which you are able to see. So you can see with your eyes that the pigmentation is increased when compared to this normal skin. This is the normal skin and this is the lesional skin. The lesional skin, in the lesion you can clearly see pigmentation is more, in skin markings are more, and if you try to close your eyes and palpate this normal skin and this lesional skin, you can easily identify that this lesional skin is very very thick. This three of them put together, it is called as lichenification, and this is in fact safety mechanism of the skin, because the patient is chronically scratching the skin to prevent any unnecessary damage to the skin. It will mount this protective response in the form of lichenification of the skin. And if you happen to do a biopsy from this lesion, that is chronic eczematous lesion, now we don't get to see spongiosis, which was predominantly seen in acute eczema. Now we are going to see a thickening of the stratum spinosum, which is called as acanthosis. So that's it in this session, friends, and this is tomorrow's MCQ. If any one of you know the answer for this, try to comment the answer for this. Not